I'm going to be talking about physical activity promotion innovations around the world. This is the outline. And the basic here is that although the case study is obesity, physical inactivity is also a global pandemic. But many countries are taking action. So if we think about research in this area, I think the United States can claim to be a leader, with others doing a lot of great work as well, especially Australia, several countries in Europe. When it comes to taking action and improving environments, policies, and programs, we are laggards. And what's really the exciting things are happening mostly in other countries. And I want to show you some of those wonderful things. So I've organized by the culture of health here, the 4 dimensions, and you can see I've got multiple examples that I'm just going to highlight very briefly on each of them. So that's our guide and where we're going. So first, let's look at social cohesion and the shared value of health. And to me, one of the best examples of this is participation. This is a national physical activity promotion initiative in Canada that started in 1971 and is still going on in some form today, although there was a lapse. It's mostly government supported, now more of a public-private partnership. And the main approaches are media campaigns. So that's been the emphasis: health communication, social marketing of physical activity. And the goal, and so they never had a huge budget, so they relied on public service announcements and free broadcasts, but they had a lot of that. They kind of do that in Canada. You might realize we don't really do that anymore. So they wanted to change social norms, you might say, create a culture of physical activity, and they used a lot of partnerships to promote their messages. And prior to 2001, when it was discontinued, the brand awareness was 96%. Everybody knew about participation. It was part of the landscape. It was part of the culture. It certainly changed the culture. And physical activity promotion tended to be coordinated in some extent through participation. After, as it's come back, the awareness is still high, but much lower. And Canada, maybe not surprisingly, is one of the few countries in the world with an increasing trend of physical activity. Very few of those countries. So there are others. One of the things that you see in other countries is people, let's say, do it in public, meaning they're active in public places. They're not hiding in the gym or on their treadmill at home. They're out doing it. And one of the great examples of this is in Brazil, where they call it Academias de Saúde. It's an organized program of led physical activity programs in public spaces, mainly community centers and public parks and plazas. And you can see here, I hope this is a pointer. Maybe it isn't. Okay, so anyway, what you can see there is 2005, there were 27 cities doing this. By 2009, there were 469 cities doing this. Here's a little bit of evaluation. And this is 4 cities, and what you see is this is the odds of being active in leisure time. So if people have ever heard of these academias, has no impact on their physical activity. If they used to participate in these academias in public, has no impact on their physical activity. If they do participate, look at the odds: 2.6, 2.2, 11, 14 times greater odds of being active in their leisure time. So some evidence that they're working. So here's the bottom line on this. The federal government is scaling up this evidence-based program. Have you ever heard of that in physical activity in the United States? No, you have not. And so they're constructing 2,800 centers, 46% of municipalities. They're going to have 4,000 municipalities by 2015. And if you can see there in green, the government has committed $1 billion to promoting physical activity in Brazil. Let that sink in. We don't have that. All right, here's another one. I have several examples from South Africa. My colleagues sent me some really great examples that I want to share with you. They're doing lots of wonderful things. One of them, this mass participation program. It's a national initiative through Sport and Recreation. It's in all provinces, and it's been going on 10 years. They have local implementers who are mainly unemployed youth recruited and trained as coaches to implement these at community centers and schools. The program has grown from 60 sites to 560, have over 1,600 participating schools. And they have some evaluation showing that this is working. So that's a fantastic thing that they are scaling up. Okay, let me show you my favorite thing. This is something called Garba. It's something I participated in, and we're gonna show it to you what this is. To me, okay. Did you see any movements there? Was there any motion? Was there physical activity? Was there culture? Was there a community? I find this amazing. It was so incredible to be there. And this is part of Indian culture. Anybody with that background will know what this is. And I just went to this one. This was a small one in Orange County on the main week for doing this. They will have 5,000 people doing this from 8 at night till 2 in the morning. All right? And so, is there anything we can learn from this? I'm guessing there is. You know, this is one of my agendas. Dance, dance is something we don't do in public very much. Dance is either for professionals where everybody watches, or it's in hidden clubs where everybody's taking drugs and things. So it's not really a mainstream thing. Every culture has dance. We have mainly eliminated dance.